The Visual Acuity Panel is used to assess a patient's vision sharpness and clarity, aiding in the diagnosis and management of eye conditions. To access the Visual Acuity Panel, you can use the shortcut on the home page or navigate to the Clinical module and select Special Clinics. In the subsequent window, the system will display all medical clinics configured within the facility. Choose Visual Acuity as shown and ensure you are signed into the designated room to access patients queued for assessment. When a patient is queued, their record will appear in the mini queue list, which displays the patient's ticket number, OPD number, name, origin, and the time spent in the queue. Before proceeding with the assessment, it's important to note that the fields in the panel are customizable based on specific information you want to capture. This flexibility allows healthcare providers to tailor evaluations to meet clinical needs, enhancing diagnosis and patient care. In this video, we will demonstrate how a clinician can use the configured panel. To begin, select the patient by clicking on their name. The patient's demographics will be displayed in the Patient's Details section. The panel can record acuity for the right eye, left eye, or both, as required. In the Acuity field, select the VA from the drop-down list. The panel is configured to use the Snellen chart, but you can also set it up to use the Logmar test if preferred. Record the visual acuity with glasses for both eyes using the drop-down list. Next, capture the pseudophakic visual acuity, which is used to assess patients who have undergone cataract surgery and have an intraocular lens implanted. Use the VA pinhole field to record acuity with a pinhole occluder and the VA pinhole over glasses field for assessments while the patient is wearing glasses. The near vision acuity field measures how well the patient sees objects up close, typically using a near vision chart. Complete the remaining fields according to your configuration. Capturing a patient's history during the assessment is crucial for understanding potential underlying causes, guiding accurate diagnoses, and developing effective treatment plans. Record the patient history as shown, and finally, click Save to store your entries. The patient summary provides key details such as medication history, visit records, lab results, and clinical notes, offering an overview of the patient's health and treatment. Below the panel, the Previous Visits section displays reports from prior appointments. You can click on the Visit Summary report if you wish to view it. Once all steps are completed, click on the Actions button and select Queue Patient to send the patient to the next service point.